2025. I'm Glenn Poole, CEO of the Australian Men's Health Forum, and today is the first of 5 lunchtime men's health chats that we're hosting throughout the week. Um, to start with, I want to acknowledge I want to acknowledge the traditional owners of the land wherever you're joining us from today, and pay our respects to elders past, present, and emerging. I'm going to drop in the traditional lands I'm joining from into the chat box here for you to see if you wish. You can also use the chat box to say hello and where in the country you're joining us from or why you're here if you want to. If you're not too familiar with Zoom, just have a look at the toolbar at the bottom of your screen, and about 3 or 4 icons across, you'll see one called chat. And if you click on chat, you can say hello in there. And our speakers already kindly put a couple of links in there as well. So recommend that you find the chat box because it's a good place to ask questions and find additional information throughout this talk today and all the talks throughout the week. So today we're starting the week with a focus on prostate cancer awareness. But before I hand over to our excellent speaker, I just want to say a couple of words about Men's Health Week. Men's Health Week is an annual event held every June, which brings a focus to different aspects of men's health. At the Australian Men's Health Forum, we've been supporting the week for over 20 years. We're really interested in a social determinants approach to health. So for us, health isn't just about those in important sort of clinical issues and diseases like one of the ones we're going to talk about today. It's also about the broader things that keep us well, our relationships, our social status, our work-life balance, our experiences of fatherhood, the way we educate our boys. All those things are important. And you'll see many of these issues reflected in the wide range of events that take place throughout the week. And this year, we're proud to launch a new website. I think, Kim, you should pop a link in the chat box if you can. Kim's been working hard putting this website together. It's the Men's Health Week events website, which shares all and any events that are happening around Australia. And if you're interested in taking part in other events throughout the week, have a look there. They range from local events that might be in your town to online events that anyone can attend. And they're just a snapshot of what's happening because most Men's Health Week events are never really advertised more widely. I think Mark, who's our speaker today, mentioned to me a couple of weeks ago that they're doing about 40 different talks across the country in different workplaces and communities. And that's true of many different organizations and many different people. So there'll be lots of conversations and activities taking place in workplaces and sheds and community settings that we'll never hear about. But if you are looking for a Men's Health Week event, at the very least, you'll know there's one on every day at lunchtime here online, and a few more besides if you look on the Men's Health Week website. So that's enough from me. I'm going to hand over now to our important guest and our speaker for the day, who's very kindly donated his time to share his knowledge and experience of a very important topic, which is prostate cancer. So I'm going to hand over in a moment to Mark Jensen. Mark's a community speaker with the Prostate Cancer Foundation of Australia, PCFA. He's also manager of the Life Force program for PCFA, which coordinates over 50 volunteer community speakers throughout Australia who go around giving awareness talks on prostate cancer across businesses, special interest groups, community groups, and organisations. As a survivor of prostate cancer himself, so he really does know the topic, Mark is still navigating the disease, and he believes that greater awareness equals saving men's lives. So he's out on a mission to save men's lives, and this talk is part of that mission. Prostate cancer, as you may know, is now the most diagnosed cancer in Australia. So really, there never has been a more important time to act. So I'm going to hand over now to you, Mark, to take it away. Thank you for being with us, Mark.
Thank you, Glenn. I very much appreciate the invitation to come and talk to everyone here today. And of course, the great work that the Australian Men's Health Forum is doing in promoting men's health and making this sort of information available to you. As Glenn said, I am a survivor. I was diagnosed 9 years ago with prostate cancer. And I'll tell you a little bit about my journey too as we go through these slides. But a little bit first on Prostate Cancer Foundation of Australia. And look, if you have any questions, hold them till the end. Many of the questions that you might have will probably be answered by the information in my presentation here today. And if there's anything else that you need to ask at the end, then we'll do a bit of a Q&A session at the end of today. Now, Prostate Cancer Foundation of Australia is Australia's leading community-based organisation for prostate cancer research, awareness, and support services. And we'll talk about some of those things as we go. But our vision is for a future where no man dies of prostate cancer and Australian men and their families get the support that they need. So, we focus on supporting research. Over our life of about 28 years, prostate cancer has supported $70 million in research projects, pretty much all of them Australian-based. And of course, they're working on things like finding a cure for the disease, but also, better treatments for men, and also better treatments for the side effects that some of those treatments actually cause for men. So very important work that we're doing with the money that we raise. We're a charity-based organisation. Now, I can't see your hands, but whether or not you know someone who's been affected by prostate cancer. With 1 in 5 men being diagnosed with prostate cancer in their lifetime and over 250,000 men living post a diagnosis, the chances are you're likely to know someone who has been impacted by the disease. So that might be a father, a brother, a husband for the women that we have on the presentation today, a son, a workmate, or a colleague. So, you don't have to look too far before you find someone who's either related to, has a friendship with, or actually has prostate cancer. So I'm hoping that by the end of this presentation, you'll know a lot more about the disease, your risk of the disease, and the importance of being able to share this information with members of the family or friends who may not have had the opportunity to hear this presentation. Now, we know many men are diagnosed with cancer from celebrities and the like, and many of them, we know, others we don't. More recently, Joe Biden was diagnosed, and that was made public. Barnaby Joyce, one of our politicians, obviously the likes of Trevor Gillmeister from NRL, David Parkin from AFL, Alan Joyce, who used to be the CEO of Qantas, have all talked about their fight with the disease and made their journey with prostate cancer public, which helps, obviously create awareness as well. But unfortunately, many men choose not to share that diagnosis, including family members. And we'll talk about the importance of knowing family history as we go through today. But firstly, I just wanted to set the scene in terms of all of the myths, not all of them, there's too many, but the myths and the misinformation that is out there in the marketplace, and also the fact that a lot of people go to Dr. Google to get their information, and you just don't know what websites you might be getting your information from. Some of the things that we hear people sort of quote to us at the foundation on literally a daily basis is that you only need to get tested for prostate cancer if you have symptoms, and this is false. When I first was diagnosed with prostate cancer, I had no symptoms at all, and we have men that go through to stage 4 of the disease, where it's metastasized throughout the body, who still haven't had the typical symptoms that you would get from prostate cancer. So that's quite false. Prostate cancer can be passed on from others, which is not true. It's not contagious or infectious in any way, but somehow it does unfortunately run in families. So, it has a bit to do with our genetics as well. Your sexual activity, or in fact any activity that you undertake, does not increase your risk of prostate cancer. Even other health factors. So if you're unfit, if you're overweight, if you have other diseases, other cancers, they are not going to increase the likelihood of you getting this disease. Whilst 1 in 5 men do get diagnosed in their lifetime, there's no commonality between, whether or not you are likely to get to the disease. Another one is men only die with prostate cancer, not from prostate cancer. And this is not true. So prostate cancer itself, whilst it won't kill you while it's contained in the prostate, once it metastasizes into the bones and vital organs like the lungs, the brain, liver, and those sorts of things, the prostate cancer can kill you once it has spread throughout the body. So that's an important thing to understand. I've heard some doozies over my time. I've had plenty of people say to me, "Oh, if you have a vasectomy, you're more likely to get prostate cancer." This is not true. A lot of men are actually diagnosed with prostate cancer when they have a vasectomy because they have these, thorough tests done, tests that they probably wouldn't have had in the past. For me, I used to be one of these middle-aged mammals riding on the weekends, in my Leica on my racing bike, and so many mates said to me when I was diagnosed with cancer, "Oh, it's because you ride, you do so much riding on your push bike." And of course, as I said before, there's no lifestyle activity that actually increases your risk of prostate cancer, including spending many hours on a push bike. An interesting one I heard was, prostate cancer is a good one to have because it won't kill you. And as I mentioned before, that's unfortunately not true. If it's not diagnosed and it's left to progress, then it's very likely that it could kill you if you don't get treatment in time. So just quickly on what we're going to go through a few things about what the prostate does, where the prostate's found, why the prostate exists, and how it works. Interestingly, when I was diagnosed with prostate cancer, I was completely unaware what it was, where it was, why it was there, what it did. I did know that it had something to do with sexual function and those sorts of things. But anyway, we'll answer these questions as we go through the presentation. So here we have an image of the prostate cancer. There is often confusion about the function of prostate cancer and where it is. As I was saying, I didn't know anything. But it actually and fundamentally is part of the male reproduction system. It starts out as a small gland around the size of a walnut and commonly grows in size in men as they age, often after the age of sort of mid-50s to 60s. It sits directly below the bladder, as you can see in the diagram there, and in front of the rectum. It surrounds the urethra, which is what we urinate through. It can impact urinary flow as it's enlarged, as it enlarges, or if it's diseased, or even if it's just infected, that sort of thing. The nerves that control sexual function and erection surround the prostate itself. But unfortunately, for some men, prostate cancer occurs when abnormal cells develop and start to grow in the prostate. So the actual prostate cells themselves start to mutate and become cancerous. In most men, prostate cancer is slow growing, and you can be easily monitored. If it stays inside the prostate gland and grows slowly, the cancer may never cause any significant issues, and it may be many, many, many years, even decades, before you would need treatment for the disease. However, the cancer may grow more quickly and cause problems that can impact your lifestyle and life expectancy. For me, when I had my diagnosis, it turned out that the cancer was both advanced and aggressive. So it was growing quickly. And at the time, we thought that it was contained to the prostate itself. But I'll talk a little bit more about that as we go. As Glenn said, prostate cancer is the most common diagnosed cancer in Australia. The quick facts are 1 in 5 men are likely to be diagnosed by age 85 or in their lifetime. 72 men a day are diagnosed with prostate cancer. That's 26,300 a year. Now, despite good survival rates, 11 Australian men still die every day. That's over 3,900 annually. There are disparities in how the disease impacts different people based on where they live and other personal socio-economic factors. In regional Australia, for instance, men face a 24% increase risk of dying from prostate cancer, but this is more due to accessing medical services, not going and getting a diagnosis, not going and getting your annual blood tests, or not having the appropriate services required for prostate cancer in some regional or remote areas. Importantly, the survival rate has now, the 5-year survival rate has increased from 28% back in the 1980s and it now sits at 95.8. So, whilst we have, 11 men die a day, thankfully, 95.8% of men do survive the disease past 5 years. And thankfully, if you're diagnosed early, then that survival rate is almost 100%. If people get onto the disease early and have the diagnosis, then they've got a better chance of being treated for the long term. I was diagnosed at age 56, which was considered young, about 9 years ago. Mind you, I'm very happy to be here today and talking to you and feeling, very fit and healthy, even though I'm still going through treatment. So it's important to know that you can live a very fulfilling life, post a diagnosis and even post some pretty significant treatments as well. Now, so some of the other risk factors for prostate cancer. Yes, your risk of prostate cancer does increase as you age. As men age, we undergo reproductive changes, and those changes are typically also in the prostate itself. So our risk of prostate cancer does increase. Why the majority of cases are in men from 50 and above, the incidence rates increase with age. So as you get to 60 or 70 or 80, the likelihood of you being diagnosed does increase. Another myth you might have heard is that many people say, oh, every man eventually gets prostate cancer. And as you heard by the stats, 1 in 5 men will get prostate cancer in their lifetime. So not everyone will. But yeah, I was quite surprised when I was diagnosed at age 56. But again, I didn't know much about the disease. I wasn't sure of, what the risk factors were. And that's why it's so important to share this information with friends, family members, men that you know that are in some of these high risk factor areas. Now, prostate cancer can run in families. Quite simply, it's a genetic factor that this happens, but it does increase the risk quite significantly. If you have one direct male relative who has been diagnosed, your risk of the disease is doubled. But if you have more than one direct family member, like a brother, a father, uncle, grandfather, um, because of those relatives all having prostate cancer, your risk increases fivefold. So that's why it's so important to, understand and know your family history. Interestingly, though, if a direct female relative, a mother, sister, for instance, has had breast cancer or ovarian cancer, that actually increases your risk of prostate cancer as well. And then some families do have some genetic mutation, which is called the BRCA or BRCA1 or 2 gene mutation. And this is where the risk is significantly higher again, and especially in younger men. So men as young as in their early 20s and 30s can often be diagnosed at those ages. And it's often found that it's the BRCA gene mutation that is present and has increased their risks. So the obvious thing to know, I suppose, and the simplest thing to remember is if you have a family history of prostate cancer, chat to your GP about getting tested from age 40. If you don't have a family history of prostate cancer, it's recommended that you tested from age 50. Now, interestingly, at the time that I was diagnosed, I had no idea really much about my family history in terms of health, especially across the the broad range of the family tree, so to speak. But when my mother had told her brother, my uncle, that Mark has got prostate cancer and is going to go in for an operation, he said, "Oh yes, I've had that. I had that 15, 20 years ago." Yet he had never shared it with anyone in the family. He was a single man. He was quite private. He wasn't about to share, you know, his prostate issues with his sister, as you would expect for someone from that generation. So sometimes you'll have prostate cancer in the family, but may never know it. So it's worthwhile asking around, ask the matriarch of the family, the person who knows, who's who in the family and who's had what and that sort of thing. There's always someone generally that has that information that they keep in their head. Now, prostate cancer often has no symptoms, as I said before. Symptoms are more likely to be noticeable once the prostate cancer has spread outside of the prostate when it becomes more deadly. The symptoms that you should look out for are things like urinating more frequently, day or night, urinating, having the urgency, that urgent feeling of needing to urinate immediately, and then sometimes, not even being able to go when you get to the toilet. So difficulty in starting or stopping the flow, taking a long time or having a weak flow, straining to urinate or pain while urinating, having blood in the urine or even in the sperm. These are normally in more advanced cases, or pain in the lower back, upper hips, or thigh area, which can suggest that there could be problems with the cancer moving into the bones. Now, many of these symptoms can be associated with other conditions of the prostate, such as prostatitis, which is an inflammation of the prostate, sometimes caused by infection. An enlarged prostate, which I said generally happens with most men's prostates over the years, or even non-prostate prostate-related issues, such as bladder issues. Or some of those symptoms I talked about could be caused from other issues relating to those sorts of things. So don't wait for symptoms. Talk to your doctor about your prostate cancer, your prostate health, and know your risk of prostate cancer, so that you can ask for the appropriate tests well and before you have symptoms. Like I say, some men get right through to stage 4 cancer and they don't really have typical prostate cancer symptoms. Now, we all know we should have regular health checks, and something that you can add to your regular health checks is a PSA test. A PSA test is a simple blood test that can be ordered by your doctor in conjunction with additional bloods that you might be getting done, like for cholesterol or blood sugar levels or iron levels, those sorts of things. PSA stands for prostate specific antigen. It is a protein produced by both cancerous and non-cancerous tissue in the prostate. So changes in the level of PSA can indicate changes in the prostate. Not always indicating cancer, but it could be, you know, those inflammations and infections that might be causing your PSA to go up. If your PSA increases rapidly or doubles, it shouldn't be ignored, and you probably need to go through and be under the care of a urologist, and that your GP would refer you to a urologist. If your PSA is raised, you may be referred for additional tests and scans. You talk to your GP about testing, or you can also call Prostate Cancer Foundation of Australia and even talk to one of our prostate cancer specialists if you're not sure about whether you should get tested, about symptoms that you might have. In fact, any question that you might have about your prostate cancer or prostate health. And as I've said before, please share this information with, you know, other men that you know. It's really quite important. My diagnosis was unfortunately missed in the first year that it had increased. I'd been having a PSA blood test added to my annual blood tests since age 50, and up until age 55, it was all good. It was sitting right in the middle of the key level. At 55, my blood test showed that my PSA had increased to the top end of the suitable scale for me, and the GP missed that it had actually increased and almost doubled in that 12 months. So my diagnosis was missed the year that I could have been diagnosed in stage 1. And the following year, at my next test, I started to actually present with symptoms, going to the toilet a lot at night, that sort of thing. Interestingly, one of the things that really made me go to the doctor to see, what's going on, was that I used to play golf a lot. I'd be running off into the trees 3 or 4 times, not to find my ball, but to go, and relieve myself. And of course, my mates that I was playing with would say, "Come on, Jensen, get out of the trees. We're here to play golf, not water the plants." So, you've got to take notice of those sorts of things. And yes, unfortunately, that year later, I was diagnosed with more aggressive and advanced prostate cancer. As I said, survival rates are high. Thankfully, the 5-year survival rate at the moment is 95.8, which is sensational. But thankfully, if the diagnosis is found early in stage 1, there is almost 100% survival rate. If we detect it before it spreads outside of the prostate, we know that we have a better chance of beating it. And actually, taking steps in some cases where you will no longer have a problem with prostate cancer. Unfortunately, there still is always a small risk of it occurring. Again, talk to your GP or talk to one of our telenurses to get more information in relation to that. Now, a little bit on on treatments. There's numerous ways to treat prostate cancer, but 80% of men with low-risk forms of prostate cancer will be what they call actively surveyed, where they just, take the PSA blood test on a more regular basis. And if the prostate cancer or the PSA is growing very slowly, going up very, very slowly, they don't need to act immediately with treatment. And some men might go years and years before they actually get to a point where they need treatment. However, if there are any changes to the prostate, or the prostate prostate cancer shows signs of threat spreading, we can actually take action, with an appropriate treatment at that time. The most common form treatments for intermediate to high risk prostate cancer men is surgery, which is either nerve-sparing surgery or radical prostatectomy, radiation, or hormone therapy. For men with advanced forms of prostate cancer that has spread throughout the body, chemotherapy is often used in conjunction with hormone therapy. And I must say that there are constant improvements to diagnoses, treatment, even treatments for side effects for some of the treatments that we have. So, your options are always being updated. For me, because it was missed in the first year, the second year it turned out with being advanced and aggressive. It had just escaped from the prostate. I had a prostatectomy, having the full prostate removed. I had 7 weeks of radiation therapy and hormone therapy in conjunction with the radiation therapy. For me, I was clear for almost 5 years and unfortunately had a reoccurrence about 2 years ago. And now, just in the last 2 months, I've gone on to hormone therapy, which stops the growth of the cancer, doesn't cure it. But while we stop the growth of it, it gives us time to, hopefully have new treatments come along that will be able to address the cancer or remove it. If a family has been impacted, Prostate Cancer Foundation is here for you. When men and their partners are armed with evidence-based information, navigating a disease becomes easier. And whilst I talked about my treatments and diagnosis, what I've experienced won't necessarily be what every man experiences. Every man's diagnosis is different, and quite often his treatment will be completely different to the next guy. So if someone is talking to you about their prostate cancer and you might have been diagnosed, it doesn't mean that you'll be going through the same journey as they will. So it's important to have a clear plan in place for support, and men and their families can get that support through PCFA. We know that men tend to do better if they have strong support around them, and it can be challenging for men who are isolated or on their own. So it's important to have those connections. That's why we have telenursing, free telenursing service and a free telecounselling service. Unfortunately, about 20% of men will develop anxiety and depression. And for those that don't actually address that anxiety and depression, which is about 72% of the 20%, unfortunately, a significant number of those, the majority of those, can end up committing suicide because they're not addressing that depression and anxiety. So if you're ever feeling, that way, obviously we have free telecounselling service to help guide you through, where you're at with your treatment. Know that you're not alone with this disease, and we can provide care, even going from one treatment to the next, or even with side effects from some of the treatments down the track. So PCFA provides support services, as I mentioned, to men and their families across Australia. We have 110 prostate cancer specialist nurses in hospitals and medical centres around Australia. So it's quite likely that a medical centre or hospital that you go to, there might be a prostate cancer specialist nurse available to talk to you and to help you navigate, what next, where, who to talk to next, things that you might need to consider as a part of your treatment. We have the telecounselling and telenursing service, which is free, on the 1-800 number there on the screen, 1-800-220099. And it's also available for their family members. So, if your partner wanted to call, or a son, a sibling, that sort of thing, wanted to call on someone else's behalf, you can call that service Monday to Friday, and it's absolutely free. We have 138 support groups nationally, which are run by men with prostate cancer. So there's peer support there. In a group setting that you can obviously hear about other people's journeys, and typically some advice on, the practitioners that they may have seen in their area. There's also, a huge amount of information and booklets. If you use the QR code on the right, that will take you directly to all of our digital brochures on our website. We have other services like Mates Connect, where you can have one-on-one sessions with another man who's been through a very similar diagnosis and treatment program as what you'll be going through. So they can share with you their journey and some of the things that they did to help them out. There's also, and this is what I put in the chat, there's the survivorship toolkit and the information brochures where you can scan the QR code there, or go to the relevant websites listed on the page there. The Survivorship Toolkit is a fantastic website, works well on a mobile phone, and it provides almost all the information that you will need to help navigate everything from pre-diagnosis, when if you wanted, to know what questions you should be asking your GP, through to, asking questions and information on treatments for side effects that your treatment may have been causing for you. So please take advantage of using the services that we have. And obviously those services are something that all of our charity work and funding goes to pay for. It's obviously, as you can see, there's quite comprehensive, and it's expensive to run a lot of those services. So we do rely on those donations. Please remember, as I said, not every man's prostate cancer diagnosis will likely have a different range of treatments to someone else, depending on their specific diagnosis and circumstances. But it's important to still have, conversations with family about family history. If you have the disease, certainly about, what you're going through. By sharing that information helps them help you navigate and be cared for during this journey. Talk to your mates about it, because they may not be aware of the risk that they have, but certainly talk about your doctor and our telenursing service if you feel the need to. As I said, we're a charity organisation. During Men's Health Week, we run Walk for Him. I'm sort of towards the end of walking 150 kilometres. I've only got 25 to go, which I'll walk this week, started today, and raising funds, obviously, to support the program. We also do other things like long run, dry July, those sorts of things. So if you're ever interested in participating in one of those, please feel free to have a look at our website and find out more. Now, just in closing, I just wanted to pay an emphasis on what we want you to remember about this presentation. It's time to take action and take your health seriously if you're not already. So there are 3 steps that we would like you to take. Certainly check your family history, ask around, get the relatives and those, if there's ever been a diagnosis in the past. And if someone says, oh yeah, Uncle Jack died 20 years ago from lung cancer, do they know whether it was what type of lung cancer it was? It could have been prostate cancer in the lung. So, sometimes you've got to probe a little bit deeper just to ensure that you've got as much information as you can. And of course, seeking information, well, I've probably created more questions than answers here. So please, the more informed you are about your risk, about diagnosis, about the disease, the options that you have, the easier you will navigate this disease and be more positive about living with prostate cancer. It's very important. And most of all, get tested. If you're in an eligible risk bracket, so family history of prostate cancer, you should have PSA tests at least every year from age 40. And if you don't have a family history of prostate cancer, from age 50, it's recommended at least every 2 years you have a PSA blood test. It could save your life, or if you're sharing this information with other friends, it could save their life. I shared my diagnosis and what I was going through with all the guys, my golf club, and interestingly, within 12 months, six of them had been diagnosed with prostate cancer. Two of them, sort of advanced where they had to have similar treatments to me, and four of them just early stage, and they were able to go on to active surveillance. All of them, I'm very glad to say, are alive today. But just by sharing that information, I know there's at least six lives at that golf club who, and they none of them were being tested for prostate cancer, and they were all in a risk range. And remember, anyone can sort of talk to our prostate cancer specialist nurses about this. I'd just like to say thank you again to Glenn and the Australian Men's Health Forum for the invitation to come and talk to you. Thank you for your attention and listening to my presentation. I'm open to taking some questions if there's are any questions from today's presentation. Please remember, I'm not medically trained, so I can give you some information about my experience or what I did in sort of researching the disease, or I can, obviously recommend who you should talk to if you've got a particular question. So I'll just stop sharing my screen now, and we can open up for questions.
Great, thanks, Mark, and thank you. There's been loads of to everyone attending because there's been lots of chat in the background. I'm just quickly going to post a while you take a breather for a second, Mark, and
Yeah, thanks.
get yourself a glass of water. I'm just going to post a link to a feedback survey. Some of you may need to nip off, but before you do, please just take a couple of minutes to complete that survey. It really does help. But also, please stick around if you can for a few minutes because I'm sure there'll be some good questions. And remember, no such thing as a stupid question.
Correct.
If you thought it, the chances are someone else has too. So even if it's just a question that helps us dispel a myth, it doesn't matter. Any question is welcome, and you can two ways to do this. You should be able to find across the bottom, there's a reaction kind of button with a heart, and in there should be a hand raise. Yeah, there's a thing that says raise hand. So you see, I've got my hand raised now. You can see little icon. That's one way of doing it, or just pop the question in the chat box, and we'll give you the